Welcome to the Market Failures set of podcasts. There are 5 podcasts all devoted to market failures. The previous podcast was a general introduction. This podcast is the second in the series and covers the topic of providing safety nets to protect against market failure. The third podcast in the series discusses government regulations. The fourth discusses providing public goods and services, and the fifth discusses stabilizing the economy. With that said, let us begin to learn about how the government protects the people and the economy from market failures through creating safety nets for Americans. Safety nets help people when they need it. There are safety nets run by private organizations, many of which actually receive some of their funding through the government. However, there are not enough private organizations to help everyone. So in addition to partnering with private organizations such as the Red Cross and smaller ones such as homeless shelters, food banks, and community programs, the government directly provides goods and services for the good of the people. Some safety nets are meant to get people into a better financial situation where they no longer need them, and others are meant to help everyone at different points in their lives. We will discuss multiple safety nets of varying types. Also, while designed to help people from falling into poverty and instead help them lead better lives, there is considerable debate as to how well government safety nets actually work. Some safety nets are more popular than others among the population. However, in general, liberals tend to be more supportive of expanding safety nets, and thus the size of government, than conservatives. Regardless of the debate on expanding versus decreasing them, it is generally agreed upon that to a certain extent, many of these programs are needed. These programs designed to help people are also known as entitlement programs. Available to legal U.S. residents and citizens, entitlement programs are designed to help people in different ways. Some help people only in times of financial need. Others are given to each citizen when they reach a certain age. Some programs come out of the general taxes people pay, such as on their home or property, or when they buy something. Others come directly out of people's paychecks. Unemployment insurance is an entitlement program that comes directly out of an employee's wages. This employer-paid benefit gives people a guaranteed amount of money if they lose their job. Unemployment insurance usually can last for only up to 26 weeks in most states, although it does vary by state depending on available state funding. Of particular importance is that the person must be actively looking for a job in order to receive these benefits. Once a person gets a job, they may no longer receive the benefit. The amount of money a person receives in unemployment varies based on the salary they were previously making, as it is a percentage of the salary up to a cap of a certain amount, which again can vary by state. Social Security insurance also comes out of a person's paycheck. If a person pays into Social Security through their job for 10 years, they will be eligible to receive full benefits after the age of 66. Almost all jobs pay into Social Security. Social Security is the largest government-run entitlement program, taking up a little less than a quarter of the federal budget. However, this program has done more to lift Americans out of poverty than any other program, because prior to this, older adults who were no longer able to work had no way to gain income to pay for basic necessities. It doesn't only benefit the retired, however, as people can get Social Security because of disability or if they have an eligible parent who has passed away and are under 21. While there is debate on how to continue paying for Social Security in the future, Social Security remains an incredibly popular entitlement program and is broadly supported by both Democrats and Republicans alike. Another popular entitlement program is Medicare. Although there is some debate on how to continue to fund it, there is consensus that basic government-sponsored health care should be available to older Americans. It's a complicated program that basically makes sure that the retired are not left out of the health care system. In the U.S. healthcare market, many workers receive health benefits through their employers, as it is very expensive to pay for private insurance otherwise. When people retire, they often lose their health benefits through their employers, hence the need for Medicare. Medicare covers doctor's visits as well as prescriptions. Many people choose to pay more for better benefits, but a minimum level of care is always covered. Unlike Medicare, Medicaid is not something that every American will receive. Medicaid is reserved for Americans whose families make under a certain income. Because only certain people receive it, but the taxes everyone pays funds it, it is a more controversial program. While most people support some form of Medicaid, it is much more supported by liberals than conservatives. This is especially true when it comes to expanding Medicaid. Conservatives are by and large against doing so, whereas many liberals would like to see basic health insurance extended to cover most, if not all, of the population. Due to ideological differences among those governing different states, some states offer Medicaid to a larger percent of their residents than others. While some states also guarantee Medicaid for children under 18, most do not. In general, one issue with Medicaid is that while the poor are covered, there are many places where people who are not covered by employers make too much money to qualify for Medicaid, but cannot afford to buy private insurance either. But if Medicaid did not exist, most of those covered would probably have no health insurance whatsoever, which could negatively affect the medical industry. There are many other programs besides Medicaid that are meant to help the poor. These programs are collectively known as welfare programs. There is sometimes a misconception that people can choose not to work and simply collect benefits. That is actually untrue. Most recipients of welfare programs are known as the working poor. While some people may be unemployed, most recipients actually have jobs. It's just that many low-paying jobs don't pay enough money for people to be able to afford all of life's necessities. If a person works full-time but makes minimum wage, he or she will qualify for government aid. That being said, many programs are temporary. Some have certain requirements that have to be met, and others are too small to meet total demand. For example, there are more people who qualify for public housing than housing units available. Therefore, some states use waiting lists to determine who gets housing, and others use a lottery system. One program that doesn't have to be temporary and is available for those who are eligible is called the Supplemental Nutrition Assistance Program, or SNAP for short. Back in the day, people received actual stamps they could exchange for food, which is why many people call it food stamps. Now it actually works more like a debit card. SNAP is a super important program that helps combat hunger, especially among families. If we look more closely at the data surrounding SNAP, it's actually quite interesting. Participation in the SNAP program encompasses quite a large percent of the population. As of February 2019, over 35.5 million Americans received food stamps, especially throughout the southeastern United States and in New Mexico. Benefits are not very high considering the price of groceries. However, these benefits at least ensure a minimum level of nutrition. A common misconception is that certain demographics, people of certain racial groups in particular, use SNAP benefits more than other groups. However, the data does not necessarily support some of those misconceptions. People of all backgrounds benefit from this program. As previously mentioned, most SNAP recipients do indeed work. This is especially true when it comes to households with children. The data also demonstrates that a lot of people who do rely on SNAP do so in times of need, because even for those households who do not have a currently working adult, most of the adults have recently held a job. Thus, this can help people while in between jobs as well. This is where we'll end with regards to safety nets. We've learned that the private sector can't help everyone who needs it, which is why the government must create safety nets to help the people. We've also gone over a few of the major entitlement programs and taken a closer look at some of the data associated with SNAP. Continue to the third podcast in the series to learn more about government regulations created to protect against market failures.